At this time, all participants are in a listen-only mode. After the speaker's presentation, there will be a question and answer session. To ask a question during the session, you will need to press star 1 on your telephone keypad. Please be advised that today's conference is being recorded. If you require any further assistance, you may press star 0. And without further ado, I would like to welcome your host for today, Mr. Michael Schomer. Sir, the floor is yours.
Thank you for joining us for the COVID-19 media briefing for March 25th. We'll start today with opening comments from Health Commissioner Jan Malcolm, Infectious Disease Director Chris Earsman, and Office of Health Facility Complaints Director Lindsay Kruger. We also have 3 guests joining us on the call today to share comments. They include Gail Cavangold, President and CEO of Leading Age Minnesota, Patty Cullen, President and CEO of Care Providers of Minnesota, and Matt Mcneil, Director of Senior Living for Stuart Co. After their comments, we'll open it up for questions from reporters. With that, we'll now turn it over to Commissioner Malcolm.
Thanks, Mike, and good afternoon, everyone. Well, this morning, we reported the largest number of new cases that we've seen in a while. We reported 1,807 positive cases this morning on a testing volume of just under 41,000 lab tests processed yesterday. And that is the highest daily total we've seen since January 9th, when, as folks will remember, we were coming down from our late fall, early winter peak. And we note that because, as we've been talking about, we do have the potential for another spike in cases and the negative outcomes that flow from that in terms of long-term health concerns, as well as hospitalizations and even mortality. And that's why we keep reinforcing the importance of keeping up our vigilance, not letting down our guard on the basic prevention measures that we know are so critically important, even as we are making really important and encouraging progress on vaccinations. So just wanted to point out to folks that today's case count is an important reminder of how very seriously we have to take this pandemic going forward. And unfortunately, we have had a 16 new COVID deaths reported today. This is the first time we've been back in double digits for a while, and we're very sorry to see that. So we're now at a collective, cumulative, total of 6,814 of our fellow Minnesotans who've lost their lives to COVID-19 since the start of this pandemic. We currently have 345 people in Minnesota hospitals being treated for COVID-19, of whom 83 are in intensive care. On the vaccine front, just very briefly, we now have over 2.3 million total doses that have been administered to Minnesotans. That again is both first and second doses, given to over 1.47 million Minnesotans. And the number of Minnesotans who've now had a complete series of COVID vaccinations is over 878,000. So this is the positive momentum that we celebrate and want to talk some more about today. I'm going to hand it to Chris Earsman at this point for an important reminder on how consumers should be experiencing COVID-19 vaccines at no cost. Chris, back to you.
Thank you, Commissioner. Yes, I just want to take a minute to talk about billing or not billing for COVID vaccine. We've been saying for months now that the COVID-19 vaccines are no cost to people getting them, and this continues to be the case. To clarify this point, the federal government recently put out a reminder of this. They emphasized that all organizations and providers participating in the CDC COVID-19 vaccination program must administer COVID-19 vaccine at no out-of-pocket cost to the recipient and may not deny anyone vaccination based on the vaccine recipient's coverage status or network status. They may not charge an office visit or other fee if COVID-19 vaccination is the sole medical service provided, and they may not require additional medical services to receive a COVID-19 vaccination. They may seek appropriate reimbursement from a program or plan that covers COVID-19 vaccine administration fees for the vaccine recipient, such as the vaccine recipient's private insurance company, Medicare or Medicaid reimbursement, or HRSA for non-insured vaccine recipients. So you may be asked to provide your insurance information or Medicare or Medicaid information, and that's fine. But you should not receive any bills after that. The provider may not seek any additional reimbursement, including through balance billing or something like that from the vaccine recipient. Any Minnesotans aware of any potential violations of these requirements are encouraged to report them to federal officials, specifically the Office of the Inspector General at the U.S. Department of Health and Human Services by calling 1-800-HHS-TIPS or the website tips.hhs.gov. And with that, I'll turn it back to the Commissioner.
Thank you, Chris. Well, we wanted to focus today on some important milestones that we have reached in long-term care vaccination. A few weeks ago, we shared a really important progress report focused on our long-term care sector in Minnesota. We talked about how we've seen the weekly counts of coronavirus infections drop very significantly in Minnesota's nursing homes and assisted living facilities. We've shared the fact that the number of facilities with active outbreaks has also dropped very sharply, which has allowed visitation, activities, and frankly, hope to return to these facilities, to their residents, their staff, and the families of so many loved ones. And last week, we announced updated visitation guidance, recognizing the progress made against COVID-19 in long-term care, as well as the vital role that social connections play in the overall well-being of residents. And this week, we want to mark another bright milestone. We can report that by the end of this week, pretty much all residents and staff in the nearly 2,000 long-term care facilities across Minnesota will have had the opportunity to have two doses of a vaccine. I say practically all, because while we've reached 99% of those facilities, it's going to take a little bit of time to get that last 1%, for whom there might be some logistical issues or other factors at play. This is a very, very positive development, and it's the product of such important and difficult and sustained work by so many people. And it really reflects the success of a strong partnership between the public sector and the private sector in dealing with this pandemic in the context of long-term care. We're going to hear more about that partnership in a moment from the guests that have joined us today. But I just want to reinforce again why this is such an important milestone, but also to talk about what work is still ahead for us. We've made absolutely tremendous progress in vaccinating our most vulnerable Minnesotans. That was our first priority, as you know, and that is one very large part of the reason why we've seen such dramatic reductions in hospitalizations and deaths among our long-term care residents population. And this is also key to why residents are now able to have more visitation, more non-medical outings, and social connection with their family and friends. But in addition to the vaccine, I just also want to recognize just the incredible hard work that has taken place over this last entire year in our long-term care facilities and with staff working in local and state public health and our colleagues in human services to ensure that these facilities have the resources and the support that they need to prevent COVID-19 infections, whether that's access to testing, personal protective equipment, infection control resources, and the like. It's just been an incredible, incredible amount of effort by so many people. And I just want to once again salute the staff in these long-term care facilities, as well as my public health colleagues for this really tireless effort. This week's milestone around vaccinations is so encouraging, but it's not done. The work isn't done by any stretch. As I mentioned, we've offered vaccination to virtually all residents and staff but not all residents and staff have taken up the opportunity to get this protection from COVID-19. It's really encouraging that as of the last report, statewide, 80% of residents in skilled nursing facilities or nursing homes and 85% of residents in assisted living facilities have now received 2 doses of the vaccine, meaning that they are fully protected 2 weeks after their second dose. And it's good to see that the percentage of long-term care staff who've received 2 doses is improving as the weeks go by, but that number is quite a bit lower than it is for residents. The number is currently 54% uptake for skilled nursing facility staff and 45% for staff of assisted living facilities. And those numbers are obviously not as high as we'd like them to be, or frankly, as we need them to be to continue to protect these facilities and residents. And we're going to continue our work to ensure that this number among staff continues to improve. We've worked with all of those providers who are doing vaccinating around the state, our health systems, our local public health agencies, our pharmacies, to make sure that there is a system in place to continue to provide first or second doses to people living or working in long-term care facilities who need them. There's going to be an ongoing need and an ongoing program to make sure that those vaccinations are available to new residents and new staff who may move into these facilities, or to people who maybe didn't take up the opportunity when it was available in these last couple of months, but will want the opportunity at some time in the future. It's just this critical sector is going to remain a really important priority for continued vaccination. So we want to talk a little bit today and acknowledge the fact that there certainly are reasons why someone may have chosen not to get the vaccine immediately when they first had the opportunity. For example, we've heard from some staff that they are interested in getting the vaccine, but they weren't sure they wanted to be the first ones to get it. They wanted to wait a bit and see how things went with others who received the vaccine, or they wanted to get more information, or they wanted to talk with a healthcare provider or another trusted person. They wanted to build up their own knowledge base and confidence in getting the vaccine. And we understand that. This is pretty natural human desire to have more information. Nobody needs to feel guilty or embarrassed to have questions about the vaccine. We want all Minnesotans to have the opportunity to get the information that they need so that they can make a well-informed decision. And our job in the weeks and months ahead, in all of us collectively, is, especially as we get into a period where there is more vaccine available, is to make sure that our citizens have that information, the information they need to make a good decision, and that they can get it from sources that they trust. And frankly, part of that is understanding that trusted source, maybe not those of us on this phone call or in public health or healthcare even, but might be somebody closer to them. Someone that somebody knows personally, has an existing connection and relationship with. Maybe it is their own physician or a nurse they know, or a pharmacist they know, a community leader they respect and trust. And we're going to need the support and the help of those trusted sources to build public confidence as the vaccine rollout continues. And one of the reasons we asked our guests to join us, and particularly Matt from Stuart Co., is that they've had great success in their vaccination efforts with both residents and staff. And we think that for other providers and employers and other communities, long-term care and beyond long-term care, it's going to be helpful to hear about successes and best practices from peers, in addition to the kind of information we in public health are able to provide at the state level. And this is just part of our growing understanding that ending COVID isn't just a job for public health or healthcare or for government, for that matter. It takes all of us. We all need to work together to do our part, whether that part is large or small, affecting an individual, a family, or a whole community or a whole state, to reduce the spread of the virus and make sure that we get to our goal of protecting as many Minnesotans as we possibly can through vaccination as quickly and as fairly as possible. And with that, I'd like to turn it over to Lindsay Krieger, who is the director of our Office of Health Facility Complaints at the State Health Department. And I'll ask Lindsay to provide some more details about the current status of progress in long-term care. And then we'll hear from some of our other guests. So turn it over to you, Lindsay.
Thank you, Commissioner. I'd like to provide some data points on the great work the Commissioner highlighted for vaccinations in long-term care settings. All nursing homes in Minnesota have had the opportunity to have not only 2, but 3 vaccination clinics for their residents and staff. These clinics are 100% complete. 99% of assisted living type facilities have had the opportunity to have 2 vaccination clinics for their residents and staff, and 54% of these same facilities have had the opportunity to have a 3rd clinic. Clinics will be continuing in the weeks ahead. I also want to provide data on current COVID-19 status in long-term care facilities. Presently, there are 62 nursing homes, 17% of the nursing home facilities here in Minnesota that have had a COVID-19 case in the last 14 days. There are 31 assisted living type facilities, 2% of these settings here in Minnesota that currently have a COVID-19 case in the last 14 days. Overall, this means 4.5% of long-term care facilities in Minnesota have had a COVID-19 case in the past 14 days. From our MDH data, we currently have 2 counties over the 10% positivity rate. Those counties are Marshall and Pennington. As discussed on the call last week, having a COVID-19 case in a long-term care facility now does not automatically mean that visitation will be suspended. Guidance has been updated and does allow for visitation if certain criteria are met. Vaccinations for residents have brought much hope and joy back to these settings. As Commissioner Malcolm said, we have made great progress, and there is still a lot of work to do. We will continue to work to boost vaccination rates among both residents and staff, and anyone these groups who hasn't got fully vaccinated will have more opportunities to do so in the weeks ahead. This is a good time to point out that one of the reasons we see some different numbers when comparing skilled nursing facilities' vaccination rates to those of assisted living facilities is that the skilled nursing facilities have uniformly had 3 clinics where vaccinations were offered, whereas some of the assisted living facilities have only had 2. This means there are likely a number of residents and staff in assisted living facilities who went ahead with vaccination, but are not shown in the numbers yet because they have not received their 2nd dose. So long as there is virus circulating and susceptible people, we will continue to focus on boosting vaccination rates and maintaining support for facilities to help prevent infections and respond effectively when they occur. We do still need Minnesotans to do their part in this effort by helping slow the spread of COVID-19, and especially the variants we're now seeing. I will remind us all to mask up, keep social distance, stay home when sick, and get tested when appropriate. And now I'd like to turn it over to Gail Cavangold, President and CEO of Leading Age Minnesota.
Thank you so much, Lindsay, and good afternoon, everyone. Late last December, our long-term care communities began to turn a much hoped-for page in the next chapter of our fight against COVID-19 when our residents and staff became among the first Minnesotans to be vaccinated against this deadly virus. And our goal from that day to this has been to ensure that everyone who wants a vaccine can get one as quickly as possible. We are beyond grateful for this life-saving prioritization. We're thankful to our vaccinator partners at the state, in health systems, in state and local public health, and in the pharmacy community as well, who've come alongside us to make this wide-scale vaccination possible. And we celebrate everyone in our settings who have stepped forward to be vaccinated. And I do want you to know that we do celebrate, quite literally, with every vaccination clinic that has occurred in our settings. Those first vaccination clinics were festive occasions and very emotional for residents and staff alike. And now we can begin to see the results of that vaccination in our falling case rates and outbreaks, and the mounting evidence that we have a safe and effective vaccine that is working to prevent the worst outcomes of COVID-19. As you heard, the vast majority of our residents in our settings have stepped forward to be vaccinated already, and the vaccine acceptance of our caregivers and healthcare workers is growing. Our two associations, Leading Age Minnesota and Care Providers of Minnesota, are part of a state and national effort to grow our staff vaccination rate to at least 70% as quickly as possible. And with each vaccination clinic, more are coming forward. We do see it as our role and responsibility not only to encourage vaccination, but to share vaccination facts, to listen carefully to safety or other concerns that staff or residents in our settings may have, to provide one-on-one support and reassurance, to help build confidence in the vaccine, and to direct those questions that we can't answer to individuals' personal physicians so that they can discuss their concerns together. We have enlisted our own medical directors for our settings to share information. We've made use of state and national vaccination hesitancy tools to answer questions. And the commissioner mentioned the importance of trusted voices as we work to overcome vaccine hesitancy. And we're now about to launch a peer-to-peer vaccination ambassador program where vaccinated staff can help their non-vaccinated peers overcome their concerns. We know that many staff who are not yet vaccinated may be open to the views of coworkers whom they know and trust and who have already taken the vaccine. I also acknowledge that each person who is hesitant has unique concerns. And as the commissioner noted, those can range from safety to cultural or religious beliefs, or a reticence to be first in receiving a newly approved vaccine that's still under emergency use authorization. Our providers across the state are sharing best practices in achieving high rates of staff acceptance of the vaccine. And as noted, you're going to hear from one of those providers in just a moment. One of the things we have learned is that a one-on-one approach to listening and encouraging vaccination is our most powerful tool. And we believe we will continue to see vaccinations rise with each respectful conversation that we are having. We also know that COVID-19 is still very much with us. The case counts and lives lost that were announced today is a somber reminder of that. Frequent testing and rigorous infection control are still vital tools across all our care settings, and we are still vigilant in finding the right balance between safety and social connections. But today we rejoice with our residents and our caregivers for the progress that has been made, and that this progress has helped us ease visitor restrictions and reunite families. I just want to close by saying we are so grateful to those residents and their families for their patience, their perseverance, and to our incredible caregivers for their day in and day out dedication. And we look forward with you to the day when every Minnesotan can be vaccinated and we turn together the page on yet another chapter forward. And now I'd like to turn the microphone over to my colleague at Care Providers of Minnesota, Patty Cullen.
Thanks, Gail. And many of my comments are just reinforcing the comments that the prior speakers have reiterated. First of all, the high rate of acceptance of the COVID vaccine by our residents has provided what may be the most powerful tool yet in our battle against COVID-19. Since so many in our communities have been vaccinated against the virus, this new guidance that we have that I'm going to reference in just a bit allows us to take major steps forward and to invite more people into our settings with fewer restrictions and with a great deal of joy. So the reopening, as we're calling it, changes that are being allowed in our settings are very closely aligned with the success that we've had to date with our vaccination programs. And this change has been so long awaited by residents, families, but also our staff, who have had to been the ones at the front line saying, sorry, no visitations for so many months. And all of these changes would not have been possible without the COVID vaccine, for sure. And the efficacy of vaccination in our settings is evident both in the drop in cases tied to our settings, the decline in the number of deaths. We celebrated greatly the day we saw 0 in our settings again. Huge celebrations across the entire profession. And also, as we're watching carefully the outbreaks that the commissioner noted over the past few weeks, we are ever cautiously optimistic about encouragement in our settings. There was a recent study that showed an 82% decline in the number of new COVID cases in long-term care between December 20th and mid-February. And that 82% decline was a much higher rate of decline than community cases. And all of that is really attributable to the aggressive vaccine program. And as others have said prior to me speaking, the rate of vaccine acceptance among our residents is high, and we need to encourage staff to increase the protection of all within our community by getting a vaccine, and we are working hard on that. I will state, though, that like members of the public, our long-term care staff are gaining their confidence level in the COVID vaccines. As Gail noted, we were first in December, but sometimes first is not best when it comes to a new vaccine where there might be questions about efficacy and side effects. However, as time has gone on, we know the willingness of long-term care staff continues to increase. Just last week, a new survey by OnShift reveals that between December of 2020 and March of 2021, the willingness of long-term care staff across the country to get the COVID vaccine increased by 94%. And the plans to decline that same vaccine decreased by 41%. I referenced a few minutes ago the new guidance. So in addition to new guidance on visitation, there was new guidance for healthcare workers released by the state and federal government on March 15th. And it provided us with an additional incentive for our staff to become vaccinated. This important regulatory change in that guidance will now permit fully vaccinated asymptomatic healthcare workers who've been exposed, high-risk exposure. They no longer have to quarantine from work, no longer have to quarantine in the community for the 14 days following exposure. Prior to this change, some of our healthcare workers would say, well, why would I bother if it's not going to make any difference? So there is a new differentiation between vaccinated and unvaccinated workers, an added benefit. As other speakers said, we expect staff vaccination rates to continue to climb as more people gain confidence about the vaccine through the education, through the peer education, as they hear about others' experience, and frankly, as they learn that it's such a coveted thing to get by others that they feel they're missing something. And kudos to the Department of Health, the work we've done together on resources and best practices. Even this afternoon, there is a webinar on best practices that is being sent out from featuring those providers that have had such a high success rate. We believe this education is working. So for each subsequent clinic, Lynn mentioned that we have 2 and 3 clinics. For each clinic we have seen greater uptake in our staff for each clinic. And I would need to close to say the same comments that the prior speakers have all said. Since all residents in our settings are not yet vaccinated, it's still going to be essential for our communities to follow safety protocols. You will still see us screening. You will still see masks. You'll still see the infection control practices like hand washing. We know we don't have 100% of our seniors for a variety of reasons, so we know that they are most at risk for the most severe consequences of COVID-19. So we will continue to work on that balance, to take all necessary and required measures to protect our residents, and yet provide safe opportunities for meaningful social connections and visitations between residents and their loved ones. And I think the vaccination program that we've rolled out in Minnesota has been a leader in the country and has been our saving grace over the past few months as we've seen the great end result of this program. And with that, I'm going to turn it to a real live provider, Matt Mcneil, the Director of Senior Living for Stuart, and he's going to talk about how they have successfully implemented their program.
Good afternoon, and thank you, Patty and Gail and Commissioner Malcolm and Lindsay. It's humbling to be here today to represent colleagues from across the state and throughout the long-term care continuum. Last year has been a testament to the incredible role long-term care plays in the healthcare ecosystem and public health for Minnesotans. We look forward to building on what we've learned and ensuring supports for Minnesotans as they age in the community, wherever they call home, are in place for the future. For the last 18 months, I've had the privilege of serving residents and employees of the Wellington Assisted Living and the Alton Memory Care in St. Paul. To our residents and families, thank you for your support and thank you for your grace. To this incredible team, I have no words to describe the gratitude. In running the marathon, we say it takes courage to cross the starting line. In this analogy, we didn't even know where the starting line was. Looking back, was it late February when we started to build a cache of supplies? Or was it that day in early March, when others were sent home from work and we were informed we were essential? While that makes no difference now, we do feel as though we can see the finish line. We can hear the roar of the crowd and the cowbells playing and the individuals holding signs of enthusiasm and hope. Vaccination to prevent COVID-19 is as though we've turned on to Summit Avenue with only a few miles left in the race. We must stay strong. Over the last year, we've learned a great deal about COVID-19 and how to prevent the spread of infection to ourselves, our families, friends, and residents. Data supports congregate care facilities that experience outbreaks happen in communities with a high prevalence of COVID-19. In recent months, vaccines to prevent COVID-19 have been introduced as a new tool in the toolkit. Our learning, despite vaccination, our shared work is not done. Vaccination only works in concert with other shared efforts, including social distancing, masking, and washing of hands. The vaccination rate in Stuart communities is encouraging. With now more than 75% of staff and 100% of residents vaccinated, we're really encouraged about the future. Bingo is back. Our team has quickly retooled and rebuilt our life enrichment program. Our restaurant is open, and we're welcoming more elbow bumps from family members that we've not seen in a while. We realize there will be setbacks. Our community experienced a breakthrough case in late February. We flexed, followed MDH guidance, exercised our policy, tested, and as of this afternoon, we have our second round of serial test results with no new positive cases. We're very much looking forward to seeing family members this weekend. My hope is together we can tell more stories, meet with more team members one-on-one and understand vaccine hesitancy. The social determinants of health of this workforce demand our attention. They have given so much of themselves to others over the last year. It's now our responsibility to support them in their decision-making. My hope for the future is that we will see unite like the crowd at the end of Summit Avenue and audibly laud the efforts of our long-term care workforce and their incredible contribution to the pandemic. I want to thank the team at Leading Age for the continued support of their members. And to you, Commissioner Malcolm, for your tireless leadership. With that, I'll turn it back over to Michael.
Thank you, Matt, and to all our guests. Operator, we're ready to take questions.
As a reminder, to ask a question, you will need to press *1 on your telephone keypad. To withdraw your question, you may press the pound key. Please stand by while we compile the Q&A roster. Our first question comes from the line of Theo Kidd from Fox 9. Your line is open.
Hi, Commissioner and Chris. For weeks now, we have heard chatter that March 29th, the week of March 29th, would be when the states, including Minnesota, get a big increase in vaccine allocation from the federal government. The governor said a couple weeks ago as much as 350,000 vaccines would be coming in, which is close to double what we're getting now. Is that going to happen?
Hi, Theo. This is Jan. I'm going to turn it to Chris in just a sec here, but let me just very quickly thank all of our guests today, and thank you, Matt, for those powerful stories and that wonderful image. I'm going to carry that with me for a while. So thank you. I'm looking forward to that last turn on to Summit Avenue too. So Theo, so the question about is this is next week the week when we're going to see the big increase in doses? I will ask Chris to help with that. Just important to note that sometimes it's tricky to keep track of what numbers people are talking about. When I think the short answer to your question is yes, we are going to see something close to that when you add up all the different streams of vaccine coming into Minnesota, what comes directly to the state versus the federal allocation to community pharmacies and the like. But we have seen, some incremental improvements in recent weeks, and I think we're looking forward to that continuing. Chris, what can you share about kind of aggregate numbers?
Sure. Well, a couple of things. One thing that we've been waiting on, all of us across the country, has been the fact that Johnson & Johnson has been awaiting some FDA approvals for a large scale manufacturing facility. And when those approvals have been gotten, that will allow them to increase their supply dramatically. And we think that is the direction that things are going. When we look ahead to that, end of March, early April increase in doses, what we've heard from the federal government is that there should be about 30 million doses from all streams. So that would be Pfizer, Moderna, and Johnson & Johnson that would be available at that time. And when we look at that, what that means for Minnesota with our usual pro rata allocation, there's two ways we have to look at it. One is that it would be a total of about 507,000 doses, but that includes second doses for the Pfizer and Moderna. So when we look at it in terms of first doses and what that would mean for us in terms of new people that could get vaccinated each week, it ends up being about 304,000 doses coming in, both through our federal retail pharmacy streams as well as the allocation that comes to Minnesota. So it's definitely an increase in terms of what we have been receiving. And we are just, eagerly waiting to get to that point. But I can tell you that with the doses that were allocated this week that will be shipped for next week, we have not achieved that vaccine nirvana. So it may be that we'll get that in our allocation next week, or it may be the first week in April, but we know it is coming.
So the 304,000 number you mentioned, the earliest that would come would be the first full week in April, if it's not coming next week. If it's just going to be another incremental increase next week, is what you're saying.
Right. So we have gotten the allocations now for what will be arriving in Minnesota beginning next week. And so the earliest that we could get this would be in our allocations that come to us next week, that will be shipped for that first week in April. Yes. That's one of the challenges. That's one of the challenges when we talk about, this is coming this week or that week. It depends on if you're talking about the allocation week or the ship week. And so right now, what we've gotten this week is still kind of within our usual.
Okay, got it. I think that might have been where the confusion came in about this talk of the week of March 29th. So thank you.
Our next question comes from the line of Bill Werner from News Network. Your line is open.
Hi, thank you. Commissioner, I'm not asking you folks, and I know you won't let the cat out of the bag, but I think most folks know the governor's going to make a major announcement tomorrow in terms of eligibility for vaccines. My question is, if it in fact is opened up significantly to a much larger age group, how do you under the current circumstances, ensure that groups in higher age groups, that people in higher age groups who might be at higher risk of COVID are not put later in line behind the younger people who might be at lower risk? And maybe maybe this is all in the context of Theo's question as well in terms of the increase in vaccines. But can you give us a feel for, is that factored into this at all? Is that a potential concern?
Well, thank you, Bill. That's a really important point and question. This is Jan. And I think it's just really important to say, even as eligibility opens up, and we're excited about that. There's lots of positives that come with eligibility being more open. It is still going to be the case, though, that certain people are at higher risk and need to be a higher priority than others. So we are working closely with particularly our healthcare providers, the clinics and hospitals who are doing a lot of the vaccinating. They are in a particularly important position to be working with their patient population to identify the folks at higher risk and to make sure that they are, prioritized in that line. And similarly, we know that there have been parts of our community, specific populations that just have not had the same access to vaccine and who have suffered disproportionate burdens from COVID-19. And it's going to be important to continue to do really focused efforts to reach those populations as well. So there's just the bottom line point is, even as eligibility expands, there will continue to be this real focus on immunizing for the best impact and from an equity perspective. And that'll show up in the ways that we allocate doses to specific providers and specific opportunities that we will create for specific groups to get vaccinated. So thank you for that question.
Commissioner, may I just very briefly use an example? Let's say that a 25-year-old person comes in. Let's say and we don't know if they're going to be eligible based on what the governor announcement will be tomorrow, but let's say that they are, and they make an arrangement to get a vaccine. Who makes the judgment, perhaps, that someone in that provider group that's providing that vaccine to that person, that some other patient might be at higher risk? Is it the actual provider? Is it the state of Minnesota, or somewhere in between?
I think what we're trying to do here is give the folks who are providing the vaccines more flexibility to make sure that as the vaccine supply ramps up, as we were just talking about, that we're able to get every dose administered in the week that we get it, and that there's no slowing down or waiting for an eligible population. But the providers will be creating prioritized access for their higher risk populations, so that healthy 20-year-old might be told, yes, you're eligible, but we don't have a vaccine for you this week. We'll let you know when we do. So there is just an important difference for folks to understand between, eligibility and your place in line. But the good news is that line is moving and will move quite a bit more smoothly and expeditiously.
Thank you, Commissioner. Very clear. Appreciate it.
Our next question comes from the line of Glenn Howlett from Star Tribune. Your line is open.
Hi, thank you. A couple days ago, Andy Slavitt in the White House said that it didn't appear as though Johnson & Johnson was going to meet its goal of vaccines by the end of the month. And I'm just wondering, I know that you're expecting an increase in early April, but have your expectations, are you not expecting as many doses in early April as you were expecting 2 weeks ago?
Hi, Glenn, this is Jan. It's again, a good question. It just sort of underscores the fact that even when we hear kind of the summary numbers at the national level, we always wait to see what our actual weekly allocation is going to be. And so sometimes there is a gap in timing or a difference in where the federal allocation is going. It's just not as straightforward as we wish it was sometimes. But I think we have heard, frankly, different messages about the speed with which, or the certainty with which, the J&J supply would build up. As Chris mentioned, a lot of it has to do with, we understand FDA approval of a specific production site, and we all know, just to reiterate, how incredibly important it is that we know that these vaccines are safe and effective, and so we appreciate the fact that regulatory process is being carefully followed. But I think what we've heard is that we might expect, I think the technical term that the CDC has used is that the J&J might be a bit bumpy for the next couple of weeks, and that we might get more than one allocation during the week. So it just it's always good when there's more coming, but we don't have as much kind of certainty about how much and when as we will have in future weeks, I think. Chris, would you add anything there?
No, it just as you said, we expect that the number of doses allocated to us from J&J will be erratic until they kind of reach their stride, at which point they've said, that we should expect a strong showing, roughly 100,000 doses a week. But we're kind of in another in-between phase where we're waiting for them to kind of get to that point. And so, as the commissioner said, we take the projection seriously. We think about how we could use that vaccine, but until it's allocated to us to actually order against, we don't. we still remain, cautious. We only know what we've been allocated, so we can say what we think will happen, but what matters is what gets allocated to us.
Thank you. And I know the doses that went to long-term care came from a dedicated stream, but with that being almost done, will that somehow free up more doses for other groups, including racial and ethnic groups that have been disproportionately impacted?
Actually, go ahead, Commissioner.
Go ahead, Chris. That's fine.
I was just going to say, Glenn, actually the doses that went to long-term care came out of our Minnesota allocation. It wasn't a separate stream, but we sort of pre-populated that allocation, if you will, and put doses into it. So although we are continuing to make sure that there are adequate doses available to continue to provide for new residents, for staff who are willing to be vaccinated, that you're correct that is becoming a smaller proportion of our total allocation, but it was originally from our Minnesota allocation.
And the only thing I would add, this is Jan, is as you've seen, the federal government, as that dedicated long-term care focus kind of shifts, the federal government is building up this retail pharmacy program more broadly, and so that, as Chris said, it's kind of confusing about what's part of the state allocation and what's not. But I think that federal retail pharmacy program is an important kind of additional piece of the whole picture.
Thank you.
Our next question comes from the line of Brian Arola from Mankato Free Press. Your line is open.
Hello, apologies if this was covered already. My call dropped right as the Q&A began. But my question is if you have an updated number on how many UK variant cases have been identified in the state.
Chris, would you take it?
Yes, I am just pulling that up. We have seen, I have it. It's 507, or excuse me, 503. We've had 503 individuals who have been identified as having B117.
And maybe Chris, just say a little bit more about, we know that that's a small percentage of the actual cases, just by virtue of how we're doing the sampling and so forth.
Right. So that, yes, exactly. That does not represent the sum total of the circulation of B117 across the state. In fact, we think that probably over half of the cases in the state may be due to B117 at this point. But we have a surveillance system for variants that is selecting a subset of cases to be tested. Our public health laboratory is testing about 350 specimens a week. We are partnering with the University of Minnesota Genomics Center to add an additional 200 specimens for testing. And then in the next week or so, we'll be increasing that capacity when one of our laboratory partners will also be able to do testing. But nonetheless, it's a subset of all the cases. So the commissioner is very right in reminding me to let people know that when we give these numbers, it gives you a sense of the increase in spread that we're seeing across the state, but it does not reflect the absolute total number of cases that would be attributable to these variants of concern.
Operator,
Thank
we
you.
have time for one more question.
That is noted, sir. Our last question will be coming from Catherine Rickard from Minnesota Public Radio. Your line is open.
Yeah, sure. So we understand that local public health officials are getting briefed this afternoon about this expansion. Can you fill us in on what you're telling them and what they can expect?
Well, local public health is certainly a huge, important part of the vaccination strategy in Minnesota. So just as we have been trying to do with all of our vaccination partners, we're just trying to help people have a little bit more line of sight into the next several weeks of that we can forecast in terms of vaccine supply. But also, we've heard a lot of feedback, quite honestly, from providers around the state, whether that's local public health or the healthcare systems, and we're listening closely to them about kind of what's happening on the ground and how are they doing getting through the current priority populations. So we've been in that dialogue with them, and this is just an opportunity to say, okay, as we look forward to the next stages of expanded eligibility, what do we need to do to plan together and to just kind of get ready to get into the next stage? So that's the purpose of talking to them, as we do with all of our partners.
Okay, and just going back to some of the questions that were raised earlier in the call about eligibility and managing eligibility, I think on the ground, reporters are hearing that checking eligibility is kind of spotty. It just sort of depends on where you go. At a pharmacy, you might be able to say you're pregnant, for instance, when you're not, and get a shot. I mean, where's the onus, from your perspective, where does the onus lie? Is it on the individual, or should pharmacies and should providers be policing this a little bit more to really target the right people at the right time for vaccines?
Yeah, it's a really fair question, and it certainly is a hard thing to say how much effort do you put into verifying eligibility. So a lot of this really depends upon Minnesotans kind of understanding the broader principle of, the good news is there's going to be enough vaccine for everybody who wants it to get it in much faster than we had earlier thought. We thought, it would be well into the fall before lower risk folks could be getting vaccinated, and it's quite clear that that's going to be happening much sooner. That the president has said everybody's going to be eligible by May the 1st, and as you've seen many states doing, and the governor's going to be talking tomorrow about our strategy to be ahead of that goal. But that said, we do still need for people to understand that we want to find and prioritize the higher risk folks. So it's a lot of it really is on Minnesotans' understanding, and different vaccinators, have different opportunities to help with that prioritization process. And as I mentioned, and our clinics and hospitals and local public health are probably in a better position than pharmacies to be identifying and proactively going after those higher risk groups. But we also know that when we are encouraging pharmacies to work with us to make sure that we're getting the right vaccine supply into the right parts of the community to be able to reach populations that have been harder hit by the virus, just as an example. So it's not just individual level eligibility verification, but how can we be smart at getting the vaccines deeper into the communities?
And is there, from your perspective, an advantage in kind of opening it up to everyone versus sticking with this tiered approach that we've been in so far?
Well, I think it's what we're trying to just pair up here is still immunizing for impact and equity, but creating more flexibility for vaccinators to be able to just not slow down and not wait for the next eligibility category, but to be a little more flexible and able to meet the specific conditions in their community. So we certainly think there are advantages to that increased flexibility. We've certainly heard that from virtually every part of the vaccinator system, that more flexibility is a good thing. And keeping in mind that we have to be very proactive and really watch and track and carefully measure how are we doing on getting those particularly vulnerable groups vaccinated.
Okay, thank you.
That is all the time we have for today. Thank you again to our guests. We invite any reporters with additional questions to reach out to our office this afternoon. Have a good day, and we will be back with you again soon.
Thank you again for participating. This concludes today's